All right, here we go. Good afternoon. Hand hygiene. My name is Angie. I'm going to be your Harper College nursing student today. Can you verify with me your name and date of birth?
My name is Melanie Janetta, and I was born in the year 2008, and I was born on February 14th.
Awesome. So I can tell right off the bat that my patient's airway, breathing, and circulation is intact. She's breathing with ease, her airway is open, and I can feel in her hands that they are warm. And so just walking into any patient room, that's always the first thing that we're checking as nurses. But more importantly, I can also see that her level of consciousness is alert. Madeline, can you tell me what year it is?
2016.
And who is our current president?
Donald Trump.
Okay, and where are we right now?
Mommy's kitchen.
That's right, and what are we doing today?
Making a nursing video for your
Try not to kick.
professor.
Can you tell me again, what are we doing today?
Trying to making a nursing video for your professor.
That's right. And so I can tell that my patient is alert and oriented times person, place, situation. So she is alert and oriented times 4. Her speech is appropriate. Her dress is appropriate for the situation. I also wanted to talk a little bit today about cranial nerve number 2. So earlier we did have our Snellen chart, and Madeline stood 20 feet away from the Snellen chart. With covering one eye, we were able to determine that she does have 20/20 vision in both her right eye as well as her left eye. The next thing we want to talk about today, Madeline, is your body mass index. And what that is, it's a ratio of how tall you are to how much you weigh, and if that's an appropriate portion for your body size. And so we found out today that you are 4 feet 11 and your weight is 80 pounds. And that puts your body mass index on the children's chart at 16.2. So according to that chart, you are at an appropriate and healthy weight right now. Next but not least, we want to talk a little bit about our vital signs that we did earlier. Your blood pressure was within a normal range. It was 82/58. Your respirations were 16, also normal. Your pulse, your radial pulse was 62, normal, and your temperature was 36.2, which is perfectly normal, okay? The very next thing I want to do is I'm going to begin to inspect the size and shape of your head. And what I'm looking for here, just looking with my eyes, is looking to see if the scalp or if the head is round, appropriate to the shape of the body, and appropriate, more importantly, in size to the size of her body. And I can see that the head does look symmetrical in front, side to side, and front to back it also looks round and normally formed. The next thing that I'm going to do is go ahead and palpate your scalp. And what I'm looking for here is any areas of tenderness, any bumping, bruising, anything that causes her pain really. Does that hurt at all, sweetie? Okay. Throughout this, I'm also going to be lifting sections of the hair and checking for infestations, lacerations, any visible bruising, areas of soft tissue or sponginess. And at this time, I don't find any signs of that. So we can say that your head is a normal cephalic shape and there are no areas of concern. The next thing that I'm going to do, Madeline, I'm actually going to palpate your sinuses. So what that is, I'm going to put a little bit of pressure right here on your maxillary sinus. Does that hurt at all, sweetie?
No.
And right here on your frontal sinus.
No.
Does that hurt at all?
No.
And what we're looking for that is if there's any sensations of pain or sudden sharp pain while we're doing that. Nextly, I'm going to go ahead and palpate your temporal mandibular joint. And so this is right where your jaw meets. Open and close. And can you open and move your jaw side to side? I don't hear any crepitations. I don't hear any grinding or anything like that. Madeline, does that cause you any pain when you're doing that?
No.
Wonderful. So the very next thing that I'm going to do, you feeling okay? All right, can we keep going? All right, the next thing that I'm going to do is I'm going to examine your eyes a little bit. I'm going to have you follow this object through the 6 cardinal gazes of vision. And so look at this, and if you can follow it with your eyes, but without moving your head. So you can only move your eyes. Are you ready? Tell me when you're ready. Okay. And I make sure to come back to the center each time that I'm doing the 6 cardinal gazes. Go to this side. I do see that Madeline's extraocular eye muscles are moving together, simultaneously strong, and that shows me that cranial nerves number 3, 4, and 6 are intact and functioning well. The next thing I'm going to have you do is watch this as it moves towards the center. Kind of funny, right? I can see her eyes converging together. The next thing that I want to check is your pupillary light reflex. If you'll give me a minute, I'll get my light pen. Alrighty. And so the first thing that I'm going to do is check this pupil. Good. And I do see that her pupil is constricting on that. And this side. Wonderful. I do see that her pupil constricted on both sides, and so her pupils are both equal, round, reactive to light, and accommodate. And that shows me that cranial nerves number 3, 4, and 6 are all working together. Madeline, the next thing that I'm going to inspect is the actual color and consistency of your eyes. So I'm going to actually pull down your eyelid a little bit. It won't hurt, but I'm going to have you look up to the ceiling with your eyes, not with your head, just with your eyes. Wonderful. I can see that Madeline's sclera is very light. There's no yellowness, which would indicate jaundice. There's no redness, which would indicate a broken blood vessel. I can also see that the conjunctiva is very pink. Madeline, does that cause you any pain, or does it just feel generally uncomfortable?
It just feels
a little uncomfortable. That's okay. We're going to go ahead and we're going to keep going. We're going to move on to the ears next. So I'm going to go ahead and palpate the external meatus, feeling for any flakiness, lumps, areas of tenderness, or anything that causes the patient pain. At this point, does that cause you pain, Madeline?
No.
No. I'm also going to be inspecting, looking for any extra cerumen around the internal canal. I don't see any. So we're going to play a little fun game, and this is going to help me test your hearing. So this is cranial nerve number 8, and what I'm going to do is I'm going to whisper a little word, and if you hear it, you can repeat it back.
I'm Mommy.
And
is this fun?
Great. So we can see that Madeline's gross hearing is intact. The next thing that we're going to do is I'm going to inspect and palpate your nose, and so I'm going to touch your nose. What I'm looking for is that her nose is in the center midline of her face. I'm looking for any lumps, bruising, abnormal consistencies throughout the cartilage. And so what I'm doing, just feeling this. Does that hurt at all, sweetie?
No.
Okay. Next, we're going to test the patency of your nostrils. What that means is we're going to see how patent they are. Are they open and breathable? I know you have a little bit of a stuffy nose today, so they might not be the most patent. But what I'm actually going to do is put one finger over this nostril and have you breathe in and out. I hear a little bit of stuffiness, so there's definitely some congestion in there. And can we do this side as well? And this side is open with no congestion. While there was a little congestion in the right side of the nostrils, we can definitely say that both, do you need a tissue, sweetie?
Uh-huh.
All right, go ahead, run and get one. We can definitely say that both nostrils are patent and open. So for right now, we will go ahead and take a short break and be back in a minute.
Where's the paper towel to get?